Hi, I'm Janice Duran with the Office of Communications and Media Relations at the Clinical Center. I'll be your tour guide as we visit the Clinical Center, the hospital at the National Institutes of Health, or NIH, in Bethesda, Maryland. The NIH as a whole is comprised of 27 institutes and centers, or ICs. These ICs may focus on particular diseases, areas of human health and development, scientific fields, or biomedical professions and technology. Each IC plans and manages its own research programs in coordination with the NIH Office of the Director. The Clinical Center, known as Building 10, is at the heart of the NIH. It's the world's largest hospital dedicated entirely to clinical research. Our mission is to provide hope through pioneering clinical research to improve human health. Due to the COVID-19 pandemic, the hospital is currently requiring that face coverings be worn. I will go through the screening area where I'll be provided with a mask. Throughout the 1940s, as NIH institutes launched investigations into diseases, they needed a hospital to conduct patient research. In 1944, the Public Health Service Act authorized the establishment of the NIH Clinical Center, and the hospital opened its doors in July 1953. The original building is named the Warren Grant Magnuson Clinical Center. The adjoining structure to the north is the Mark O. Hatfield Clinical Research Center. Over the years, the Clinical Center has gone through many expansions and changes. Today, the hospital has 200 inpatient beds, 11 operating rooms, 93 day hospital stations, critical care services and research labs, outpatient clinics, 2 on-site pharmacies, a blood bank, and an array of imaging and diagnostic services. The North Atrium is where patients and visitors typically enter the Clinical Center. Its open space, plentiful sunlight, and inviting courtyards make it a comfortable, welcoming gathering place at the heart of the Clinical Center. Music also helps support our environment of care and healing. Several years ago, we began a partnership with the Kennedy Center and the National Symphony Orchestra to bring concerts to the atrium. Since then, we have created the series Music in the Atrium and hold regular concerts here. The many performances include patient musicians, the U.S. Army Band, the University of Maryland Jazz Combo, and other performers. The first floor consolidates all of the services that patients need upon admission or discharge from the Clinical Center. Services like the admissions desk, cashier, voucher office, pharmacy, travel office, and a central bank of elevators. Art is on display throughout the hospital, and new pieces rotate in every few months. The art is available for sale, and the proceeds support a patient emergency fund. The hospital currently hosts a minerals exhibit in collaboration with the Smithsonian Museum of Natural History. All of the minerals on display have medical applications. Over 10,000 patient volunteers per year have contributed to research that will benefit future generations by participating in studies or protocols. Study-related expenses are covered. How do we fund our patients? To participate in a protocol or research study, patients may be referred by a doctor. Patients may also reach to the study team's online app, search the studies, or call our Office of Patient Recruitment. The patients at the NIH Clinical Center are viewed as part of our team. To be here, they must meet all the requirements of a research protocol. Research laboratories are located close to patient care units for what's known as bench-to-bedside treatment. The purpose of the design is to bring research sciences as close as possible to where patients are being cared for. This promotes collaboration between clinicians and scientists and allows them to rapidly translate scientific observations and laboratory discoveries into new approaches for diagnosing, treating, and preventing disease. Researchers have made many medical discoveries here, including the use of nitroglycerin to treat heart attacks, identifying a genetic component in schizophrenia, pioneering the cure of cancerous solid tumors with chemotherapy, the creation of blood tests to identify both acquired immune deficiency syndrome, or AIDS, and hepatitis, conducting the first successful replacement of a mitral valve to treat heart disease. And now, researchers are working on finding treatments and a vaccine for COVID-19. We have produced these and many other cutting-edge treatments for the world's most deadly and damaging diseases. Currently, there are around 1,600 clinical research studies in progress at the Clinical Center. About half are studies of a specific medical condition or disease, which helps researchers understand how a condition develops and gain insight into how it might be treated. Most of the other studies are clinical trials, which often are the first test of the new drugs and therapies in people. The clinical trials at the NIH Clinical Center are predominantly phase 1 and phase 2, often first in human to test safety and efficacy. Not surprisingly, there has been a lot of media interest in our cutting-edge work here. In 2017, the Discovery Channel created a groundbreaking documentary titled First in Human: The Trials of Building 10, hosted by Jim Parsons. The 3-episode documentary followed patients, staff, and caregivers at the NIH Clinical Center. The patient library on the 7th floor offers thousands of books, magazines, and newspapers. Next to the library, you'll find the Interfaith Chapel, which provides a peaceful place of respite and reflection. All faiths are welcome, and it is open 24 hours a day. The Clinical Center is committed not only to caring for the body, but also the mind and the spirit as well, and to accommodate and honor those elements of the human experience. Now, let's visit a few departments and meet some of our staff.
Hello, I'm Lyra Sample. I'm a clinical research nurse on the Special Clinical Studies Unit, also known as the SCSU. This is an inpatient unit that consists of 7 beds. Let's take a look at one of our specialized rooms. This unit has been in operation since the summer of 2010 to care for patients participating in a variety of clinical research protocols, including influenza and virus studies. The SCSU is designed with state-of-the-art infrastructure that allows for isolation capabilities and infection control. For example, our entire unit is negative airflow with the exception of the nurse's station and lounge. In these rooms, we provide medical surgical care as well as ICU level care. Currently, we are providing care for participants diagnosed with COVID-19. We train all personnel on how to don and doff personal protective equipment safely in order to care for patients. We are also trained to transport our patients in a secured manner on an authorized route throughout the clinical center. This is to minimize exposure.
Hi, my name is Heather Crum, and I'm the manager for the Department of Laboratory Medicine. Our laboratory provides the hospital's outpatient phlebotomy service, as well as clinical diagnostic testing in chemistry, hematology, immunology, microbiology, and the sterility testing service. We also conduct research on cancers of the blood and lymph nodes, genetic disorders, diabetes, and antibiotic-resistant bacteria. Technology in our laboratory includes large, high-throughput automated chemistry analyzers, digital cellular imaging, mass spectrometry, nuclear magnetic resonance, and next-generation sequencing instruments.
Hi, I'm Dr. Malagiri, one of the radiologists and a staff clinician in the Department of Radiology and Imaging Sciences. Our department provides imaging services for clinical center patients who are participating in research protocols conducted by various institutes on the NIH campus. Our services include X-ray, fluoroscopy, ultrasound, magnetic resonance imaging, computed tomography or CT, and interventional radiology. We also conduct cutting-edge research studies of clinical imaging procedures and offer training in clinical imaging.
Thank you for your interest in the Clinical Center. We've only shown a few of the highlights in this video. For more information or to see our current clinical trials, please visit our website.